Hey everyone, welcome to another deep dive. You know we love to dig into all things medical careers, and today we're tackling a big one. Choosing a medical specialty.
One of the biggest decisions you'll make in your journey.
For sure. And to make it even more interesting, you've sent over a ton of resources, like a comprehensive guide and even a specialty selection FAQ.
Wow, that's impressive.
Yeah, we've gone through it all.
Yeah.
We're ready to break it down for you.
It sounds like you're prepared for a deep dive indeed.
So let's get started. Our mission today is to sift through all this info and help you figure out what truly matters when it comes to picking a specialty.
It's about finding the perfect fit for you, your unique blend of passions and priorities.
Okay, I'm seeing a note here about wanting something captivating, something that really grabs your interest.
Yes, passion is key.
So what clinical areas have really sparked your interest during rotations or maybe even just in your studies? What gets you fired up?
It's all about finding that intersection between what fascinates you and the day-to-day realities of different specialties.
So it's not just about what's interesting, but also how your skills and personality fit into the mix.
Exactly. Imagine someone with incredible dexterity. They might be drawn to surgery. But here's a question. Is dexterity truly the most crucial skill for a surgeon? Or is it more about spatial reasoning, that ability to visualize complex 3D structures in your mind?
That's a really interesting point. I never thought about it that way. What about someone who loves puzzles and problem solving?
They might find a fantastic fit in diagnostic fields like radiology or pathology, where you're piecing together clues from images or lab results.
Oh, I like that. A medical detective.
Yeah.
You also mentioned flexibility as a priority. What does that look like for you? Are we talking shift work versus predictable hours, or maybe location independence, maybe even part-time options down the road?
Flexibility is a huge one, and it can mean so many things in medicine. Some fields like telemedicine are creating new possibilities for location independence. But let's be real about the time commitment, especially early in your career.
Yeah, I'm thinking about that surgeon I shadowed a few years ago. Brilliant in the OR, but constantly struggling to balance work and family life.
It's a common challenge in high-intensity fields like surgery. I'm not saying it's impossible to find that balance, but it's definitely something to weigh carefully.
For sure. Okay, next up, residency training. You flagged the length of training as a major factor, and no wonder neurosurgery is like an ultramarathon, potentially 6-8 years or even more, compared to family medicine's 3-4 year sprint.
Duration is a big consideration, but also competitiveness. Dermatology, plastic surgery, notoriously competitive specialties.
Stellar grades, glowing recommendations, research publications, the whole 9 yards.
And speaking of standing out, the NRMP website has data on average match scores for different specialties. It's a helpful tool to kind of gauge how competitive things are.
Oh yeah, the NRMP match. I remember feeling so overwhelmed by that whole process.
Don't forget, if you're in Canada, there's CARMAMS. And for certain specialties, there's the SF match. We won't get into the nitty-gritty of them right now, but they're definitely worth exploring as you narrow down your choices.
Okay, got it. You've also mentioned mobility and future plans. Where do you see yourself practicing long-term? Big city, small town, specific region?
Your vision for the future plays a crucial role here. We need to connect that with the realities of the job market.
Makes sense.
Supply and demand are key. Rural areas often have a greater need for general practitioners, those who can handle a bit of everything.
Makes sense. In a rural setting, you might be the only doctor for miles around. You need to be comfortable with a wide range of medical issues.
Exactly. Specialized fields tend to be more concentrated in urban centers or teaching hospitals. By the way, the WHO has some fascinating data on global health workforce needs. Just planting a seed here, certain countries and regions have critical shortages in specific specialties.
Interesting.
Might open up some possibilities if you're open to practicing abroad.
Okay, let's talk about money. You highlighted financial considerations. We all know passion should come first, but income potential matters too.
Of course, it's a valid consideration, but it's not always about the most procedure-heavy specialties. Some fields, like certain types of radiology or pathology, can be surprisingly lucrative.
Really? I always thought those were more on the lower end of the income spectrum.
It's a common misconception. They require such specialized skills, and there's a high demand for those skills.
Okay, so it's not just about the salary though.
Right.
Think about the opportunity cost.
Yeah.
Longer training means more years of earning a resident salary.
Before hitting your full earning potential. Got it.
Okay, so we've talked interests, lifestyle training, job market, and finances. Feeling overwhelmed yet?
Just a little.
Don't worry, there's more. Let's get a little personal for a moment. Think about your personality and what kind of practice environment you thrive in.
Yeah.
Imagine the high energy OR, the quiet lab, the bustling clinic. Which one energizes you the most?
Ooh, good question.
This is where it gets fascinating. Specialty choice often reflects broader personality traits. Some people are drawn to fast-paced, team-oriented environments, while others prefer a more independent-focused approach. I can see that.
I once knew a physician who started in cardiology, drawn to the intellectual challenge, but quickly realized the high-pressure, fast-paced environment clashed with their personality.
Oh, wow.
They ultimately found a better fit in a less intense specialty. It's a reminder that we don't always know ourselves as well as we think we do.
That's a good point. Okay, I like this. So we're matching personality with the work environment.
Exactly. It's about finding that alignment. And it's not just about finding the perfect fit for who you are right now. Your interests and priorities might evolve over time.
You mentioned finding role models. Who are the physicians you've encountered who seem genuinely happy and fulfilled in their work? What is it about them that stands out to you?
Mentorship and departmental culture are so important.
Yeah, for sure.
Observing those role models, it's not just about their clinical skills, right? It's how they interact with their teams, the nurses, the residents, even patients who are having a bad day.
It's the whole package. It's the human side of medicine.
Exactly. Shadowing or electives can offer incredible insights into a department's culture. It's like getting a behind-the-scenes look at how they handle pressure, celebrate successes, support each other.
It's a glimpse into what your daily life might be like in that specialty. Okay, so we've laid some groundwork. We've talked about personal factors, realities of different specialties, and even peeked into the world of mentorship.
We're just getting started.
Now buckle up. It's time for our whirlwind tour of some core specialties: internal medicine, family medicine, pediatrics, surgery, OBGYN, psychiatry, emergency medicine, anesthesiology, radiology, and pathology.
That's quite a lineup.
We're going to try to highlight the essence of each specialty, the key takeaway that captures its spirit. We'll touch on the pros and cons, and maybe reveal a few surprises along the way.
Sounds good. Let's jump in.
First up, internal medicine, often considered the foundation of adult medicine.
Internal medicine is all about diagnosing and treating a wide range of conditions in adults, from something as simple as the flu to managing complex chronic illnesses like diabetes or heart disease. Imagine being a medical detective, piecing together symptoms, running tests, figuring out the best treatment plan.
That sounds pretty intellectually stimulating, but I imagine it comes with a heavy workload, especially when you're dealing with patients who have multiple health issues.
You're right. The administrative burden can be significant, and it can be emotionally demanding too, caring for people with serious long-term illnesses. Building strong patient relationships is crucial.
It's about more than just treating the disease. It's about caring for the whole person. That makes sense. Okay, what's next on our specialty tour?
Let's switch gears to family medicine. If you're envisioning a career that spans generations, caring for patients from newborns to the elderly, family medicine might be the path for you.
So building those long-term relationships, watching your patients grow and change over time. What about the challenges of family medicine? Dealing with such a diverse range of patients and medical issues must be tough to stay on top of everything.
It's true. Staying on top of everything can be a challenge. Family physicians need to be incredibly knowledgeable and adaptable, switching gears from a well-child checkup to managing complex chronic conditions in an elderly patient.
Sounds like it definitely keeps you on your toes. What about work-life balance in family medicine?
That's one of the potential perks. While the pay might not be as high as some of the more specialized fields, family medicine often offers a lot of flexibility in terms of practice settings and hours. You could work in a rural community, an urban clinic, or even open your own private practice.
So many options. It often comes down to finding the right fit for your lifestyle. Okay, next stop, pediatrics. The land of tiny humans, teddy bears, and maybe a few temper tantrums along the way.
You might encounter a few of those. Pediatrics is all about caring for infants, children, and adolescents. It's a field where you get to witness incredible growth and development, guide families through those early years, and play a vital role in shaping the health of future generations. But let's not sugarcoat it. Pediatrics is not always sunshine and rainbows.
I was just thinking that. Yeah.
You'll encounter childhood illnesses, parental anxieties, and even heartbreaking situations. You need a strong stomach and a compassionate heart.
That's a great point. It's easy to get caught up in the cuteness factor, but it's important to remember that pediatrics can be emotionally challenging.
Absolutely. And one of the biggest challenges in pediatrics is communication. You're not just treating the child, you're also working closely with their parents or caregivers, explaining complex medical concepts in a way that's easy to understand and reassuring.
And I imagine it can be heartbreaking to deal with a child who is seriously ill.
It's one of the realities of the field. But it's also a specialty where you witness incredible resilience and the power of healing. And if you're looking for variety, there are tons of subspecialty options within pediatrics, neonatology, cardiology, oncology, and more.
Okay, enough with the cuteness overload. Let's scrub in and explore the world of surgery.
Hold on to your scalpels. Surgery is a field that demands precision focus and stamina. It's about the thrill of performing life-saving procedures, the satisfaction of seeing immediate results, and the intense camaraderie of the surgical team.
It's definitely a high-stakes, high-reward specialty. What about the training? I imagine it's pretty intense.
Surgical residencies are known for their long hours and steep learning curve. You're handling complex cases and making critical decisions under pressure right from the start.
Definitely not for the faint of heart. But what are some of the perks of choosing a surgical path?
For one, you're literally using your hands to heal. There's a certain immediacy to surgery that many find incredibly gratifying. And the teamwork aspect is a huge draw for many surgeons. You're working closely with nurses, anesthesiologists, and other specialists, all focused on the same goal, the patient's well-being.
The team aspect sounds amazing, like a well-oiled machine working together to save lives.
Exactly. And the field is incredibly diverse. General surgery is just the starting point. You can specialize in everything from cardiothoracic surgery to neurosurgery to plastic surgery. The possibilities are pretty much endless.
All right, let's shift gears to a specialty that's both unique and incredibly rewarding. Obstetrics and Gynecology, or OBGYN for short.
OBGYNs experience the full spectrum of women's health, from prenatal care and delivering babies to treating a wide range of gynecological conditions. They're comfortable in both the clinic and the operating room, providing both primary care and surgical expertise.
I'm struck by something in the FAQ. It mentions OBGYNs often facing ethical dilemmas, especially in today's world. How does that resonate with you?
It's a valid point. OBGYNs often navigate complex ethical issues related to reproductive rights, pregnancy complications, end-of-life care. It's a field that requires not only medical expertise, but also a deep understanding of ethical principles and a strong moral compass.
It sounds like a challenging, but also incredibly rewarding field. You're there for some of the most profound moments in a woman's life.
You're right. You're dealing with women at their most vulnerable, whether it's navigating a high-risk pregnancy or facing a difficult diagnosis. But it's also a field filled with incredible moments of joy and the celebration of new life.
And I imagine the bond you form with your patients is pretty special, especially when you're caring for them through different stages of life.
Absolutely. OBGYNs often develop long-term relationships with their patients, starting in adolescence and continuing through motherhood and beyond.
Okay, next up, psychiatry. It's a field that's so crucial, especially with the growing awareness of mental health issues.
Psychiatry is all about understanding and treating mental health conditions. From anxiety and depression to more severe disorders like schizophrenia and bipolar disorder. It's about helping people cope with life's challenges, navigate difficult emotions, and find ways to live fuller, more fulfilling lives.
I imagine it requires a unique blend of skills. You need to be a great listener, a skilled communicator, and have a deep understanding of the human mind.
Exactly. You're not just prescribing medications, you're building trust and rapport, helping patients understand their conditions and empowering them to take control of their mental health.
It sounds like a challenging but incredibly rewarding field. What are some of the different paths within psychiatry?
There's a lot of flexibility within psychiatry. You can specialize in child and adolescent psychiatry, geriatric psychiatry, forensic psychiatry, the list goes on. You can also choose to work in a variety of settings, from private practice to hospitals, community mental health centers, and even correctional facilities.
So many options. Yeah, ready for our next adventure? Hold on tight, we're heading to the ER.
Get ready for the adrenaline rush. Emergency medicine is all about the unexpected, the high-stakes decisions, and the intensity of life or death situations. You'll encounter everything from traumatic injuries to heart attacks to strokes and seizures.
It definitely sounds like a specialty for those who thrive under pressure. What are some of the essential skills for an ER doctor?
You need to be a quick thinker, able to assess situations, rapidly stabilize patients, and determine the best course of action, often with limited information.
Wow, that sounds intense. What about the lifestyle? I imagine the hours are pretty unpredictable.
You're right. ER doctors often work long and unpredictable shifts, including nights, weekends, and holidays. It can be tough on your personal life, but there's also an incredible camaraderie in the ER, a sense of purpose, and the satisfaction of knowing you're making a real difference in people's lives.
And I bet there's a certain adrenaline rush that comes with saving lives in those critical moments.
Absolutely. It's a specialty that's not for everyone, but for those who are drawn to its unique challenges and rewards, it can be incredibly fulfilling.
Okay. We've explored the high-energy world of the ER. Now let's step into a slightly calmer but equally important part of the hospital: anesthesiology.
Anesthesiology is the silent guardian of the operating room. They're the experts in keeping patients safe and comfortable during surgery, ensuring they're pain-free and their vital signs are stable throughout the procedure.
It sounds like a huge responsibility. What kind of personality thrives in that environment?
Anesthesiologists need to be calm, under pressure, detail-oriented, and able to make quick decisions in critical situations. They also need to be excellent communicators, able to explain procedures to patients and reassure them during what can be a very anxious time.
I imagine it takes a very specific type of person to handle that level of responsibility with grace and expertise.
You're right. Anesthesiology is a demanding field, but it also offers the satisfaction of knowing you're playing a vital role in every successful surgery.
Okay, let's move on to a specialty that always seemed a bit mysterious to me: radiology.
Radiology is all about using technology to see inside the human body. Radiologists are the experts in interpreting medical images. X-rays, CT, scans, MRIs, helping to diagnose a wide range of conditions, from fractures and tumors to infections and heart disease.
So they're like the detectives of the medical world, using clues from images to solve the puzzle of what's going on inside the body.
That's a great way to put it. They play a crucial role in guiding treatment plans, monitoring disease progression, and even performing minimally invasive procedures using image guidance.
Wait, so radiologists aren't just looking at images all day. They actually perform procedures too.
You bet. Interventional radiology is a rapidly growing subspecialty within the field. They use imaging techniques like X-ray and ultrasound to guide needles and catheters, performing biopsies, draining abscesses, treating tumors, and more. It's a fascinating blend of technology and hands-on procedures.
I had no idea. It sounds like a perfect blend of technology diagnosis and hands-on procedures.
It is. And while radiology might seem like a solitary profession, it actually involves a lot of collaboration with other specialties. Radiologists are constantly consulting with surgeons, oncologists, neurologists, and other physicians to provide expert interpretations of images and help guide patient care.
Okay, we've saved the best for last. Let's explore the often hidden world of pathology.
Pathology is often called the cornerstone of medicine. It's the specialty that studies diseases at a microscopic level, analyzing tissues, cells, and body fluids to diagnose illnesses, determine the cause of death, and guide treatment decisions.
So they're the ones who provide the definitive answers, the ones who ultimately confirm what's going on with a patient.
Exactly. They're like detectives, but instead of footprints and fingerprints, they're looking for clues in cells and tissues under a microscope. It's incredibly meticulous and detail-oriented work.
It sounds like you need a sharp eye for detail and a deep understanding of disease processes to thrive in that field.
You're absolutely right. And while pathology might not involve direct patient interaction, it has a profound impact on patient care. Pathologists provide the essential information that doctors need to make informed decisions about treatment.
I'm starting to see why it's considered the cornerstone of medicine. It's like the foundation upon which all other specialties build their diagnoses and treatment plans.
Exactly. And within pathology, there are two main branches: anatomic pathology and clinical pathology. Anatomic pathologists focus on analyzing tissues, performing biopsies, and determining the cause of death through autopsies. Clinical pathologists, on the other hand, analyze blood, urine, and other body fluids to diagnose diseases and monitor patient health.
So if you're someone who loves science, thrives on precision, and enjoys the challenge of solving complex medical mysteries, pathology could be a great path for you.
Absolutely. And with that, we've completed our whirlwind tour of some of the most popular medical specialties.
Wow, that was quite the adventure. I'm feeling a bit overwhelmed by all this information, but also incredibly excited about all the possibilities.
It's a lot to take in, but remember, the goal here isn't to memorize every detail about every specialty.
You're right. It's about getting a sense of what each field is all about and seeing where your interests and skills might align.
Exactly. It's about finding those sparks, those moments where you think, that sounds intriguing. I want to learn more about that.
So what's next? How do we move beyond information overload and actually start making some decisions?
Great question. It's time to shift from exploration to action. And luckily, you've got a fantastic guide that outlines 6 practical steps to help you narrow down your options and find the specialty that's right for you.
Perfect. We'll dive into those steps and much more when we continue our deep dive in part 2. See you soon.
Welcome back to the deep dive. Last time, we explored a whirlwind of specialties. Now we're going to equip you with the tools to dig deeper. Remember that stack of resources you shared.
Yes, professional organizations, specialty societies, online forums, we've got it all. It feels a bit like a treasure map leading to the perfect specialty.
Exactly. And we're here to help you navigate that map. Let's start with those professional organizations. Think of groups like the American Medical Association, the AAMC, or the British Medical Association. They offer a wealth of knowledge about medical careers in general.
They're like the backbone of the medical community, providing a broad perspective.
Yeah.
What about if you want to get into the nitty-gritty of a specific field?
That's where specialty-specific societies come in. The American College of Emergency Physicians, the American Psychiatric Association. Each specialty has its own organization. These societies offer incredible insights into the day-to-day realities of that field.
It's like getting the inside scoop from the people who are actually living and breathing that specialty.
Yeah.
Do they have resources specifically for students who are trying to figure out what path to take?
Absolutely. Many of these societies have student memberships, which give you access to journals, conferences, and mentorship programs. It's a great way to connect with experienced physicians and learn from their journeys.
It sounds like a fantastic way to immerse yourself in the world of a particular specialty and really see if it's a good fit. What about the practical side of things, like residency applications and the match process?
You're thinking ahead, and that's great. Resources like the NRMP and CARMS websites, those are essential for navigating the residency landscape. They have tons of data on competitiveness, program requirements, and even salary expectations.
Man, I remember feeling so overwhelmed by the NRMP website when I was applying for residency. There's just so much information.
It can definitely be a bit daunting. But one helpful tip is to focus on the data that's relevant to your top choices. Look at the average match scores for each specialty, the geographic distribution of residency programs, and any specific requirements that might stand out.
That's a great point. It's about filtering the information and finding the nuggets that are most relevant to your personal goals.
Exactly. And don't underestimate the power of online forums and communities. Places like the Student Doctor Network, they're gold mines of real-world experiences and honest opinions.
Oh yeah, I remember spending countless hours on those forums during med school, just soaking up the wisdom of those who had gone before me.
It's a great way to connect with other students and residents, ask questions, and get a sense of the culture and challenges of different specialties. Remember, you're not alone on this journey.
Okay, so we've got professional organizations, specialty societies, residency matching websites, and online forums. What about staying up to date on the latest research and trends within each specialty?
That's where peer-reviewed journals come, and publications like JAMA, The Lancet, the BMJ. They often have articles or even entire sections dedicated to career advice and workforce trends in medicine.
It's like getting the inside scoop from the leading experts in the field. It can be a bit overwhelming, though, trying to keep up with all the latest research.
You're right, it's impossible to read everything. Focus on the journals that are relevant to your top specialty choices. Look for review articles that summarize the latest findings or opinion pieces that offer perspectives on the future of the field.
That's a great strategy. It's about being selective and prioritizing the information that's most likely to be helpful. And of course, don't forget about podcasts like ours.
A shameless plug, but a valid point. Podcasts can be a fantastic way to learn about different specialties, hear from physicians on the front lines, and get a sense of the culture and challenges of various fields.
All right, we've covered a ton of different resources. It's amazing how much information is out there.
Yeah.
Is there one resource that really stood out to you as being particularly helpful or insightful?
You know, I was particularly impressed by the AAMC's Careers in Medicine website. They have an incredible collection of resources for students exploring different specialties.
I've heard good things about that website. What makes it so special?
They have everything from self-assessment tools to data on competitiveness to virtual specialty tours.
Wait, virtual specialty tours? That sounds amazing. What are those like?
They're incredibly well done. They feature interviews with physicians, videos of procedures, and even 360-degree views of different work environments. It's like getting a sneak peek into the world of that specialty without even having to leave your house.
That sounds like a fantastic way to get a more immersive experience. I'm definitely going to check it out. It's amazing how technology is changing the way we explore career paths.
It's pretty remarkable. Okay, we've talked about the different types of resources available, but how can we use all this information effectively? It's easy to feel overwhelmed by the sheer volume of data out there.
Oh, it's like drinking from a fire hose sometimes. How do we make sense of it all?
The key is to approach this exploration with curiosity and a willingness to experiment. Don't try to absorb everything at once. Start with the resources that pique your interest and gradually expand your exploration.
It's like building a puzzle.
Yeah.
You start with a few key pieces and gradually add more until you get the full picture.
Exactly. And as you're exploring these resources, take notes, highlight key takeaways, and jot down any questions that pop up. Having a system for organizing your thoughts will make this whole process much more manageable.
That's such good advice. I remember feeling like I was drowning in information when I was first starting out. Having a system for organizing my thoughts would have been a lifesaver.
It's all about finding what works for you. Some people prefer to take handwritten notes while others are more comfortable with digital tools. The key is to find a system that helps you process and synthesize the information.
And remember, this is a journey, not a race. It's okay to take your time, explore different paths, and even change your mind along the way.
Absolutely. There's no right or wrong way to do this. You're not committing to anything at this stage. It's all about exploration and discovery.
Speaking of changing your mind, have you ever felt drawn to a particular specialty and then completely changed course?
Oh, absolutely. When I first started medical school, I was convinced I wanted to be a surgeon. I loved the idea of performing complex procedures and seeing immediate results. But as I went through my rotations, I realized that the long hours, the high-pressure environment, and the lack of continuity of care weren't a good fit for my personality or my lifestyle.
Wow, that's a big shift.
Yeah.
What happened next? What made you realize that surgery wasn't the right path for you?
It was a gradual realization. I started noticing that I felt drained after my surgery rotations, whereas I felt energized and fulfilled after my family medicine rotations.
That's fascinating. It sounds like you were really tuning into your gut feelings and paying attention to how different specialties made you feel.
Exactly. And it's not just about how you feel during the rotations, it's also about envisioning yourself 5, 10, 20 years down the road. Can you see yourself being happy and fulfilled in that specialty? Does it align with your values and your long-term goals?
That's a great point. It's about thinking beyond the immediate excitement of a particular field and considering the long-term implications for your life and your well-being.
Absolutely. And sometimes it's those unexpected detours that lead us to our true calling. I never would have imagined myself in family medicine when I first started med school, but it turned out to be the perfect fit.
That's such an inspiring story. It gives me hope that even if we don't have it all figured out right now, we can trust the journey and be open to new possibilities.
Exactly. And remember, you don't have to do this alone. You have mentors, peers, and a whole community of resources to support you along the way.
Okay, so we've talked about using resources effectively, embracing the journey, and being open to changing our minds. What other words of wisdom do you have for our listeners as they navigate this exciting but daunting decision?
Here's a thought. Don't just focus on what each specialty is, but also consider what it isn't. This can be really helpful for ruling out fields that don't align with your values or priorities.
Oh, I love that. It's like a process of elimination. If you know you absolutely can't stand working nights, or the idea of being in an operating room makes you queasy, you can cross those specialties off your list right away.
Exactly. It's about being honest with yourself about your deal breakers, the things you absolutely cannot compromise on. And there's no shame in admitting that certain aspects of medicine don't appeal to you.
I'm also remembering a piece of advice I got from a mentor. Don't just choose a specialty, choose a lifestyle.
That's brilliant advice.
Yeah.
It's so easy to get caught up in the prestige or the perceived earning potential of certain specialties, but at the end of the day, you need to choose a path that allows you to live a life you love both inside and outside of medicine.
Absolutely. It's about finding that sweet spot where your passion, your skills, and your lifestyle all align. And sometimes that means choosing a specialty that might not be the most glamorous or the highest paying, but it's the one that will bring you the most joy and fulfillment in the long run.
Exactly. And as you're exploring your options, don't just rely on books and websites. Talk to people who are actually working in those fields. Ask them about their daily routines, their work-life balance, and what they wish they had known before choosing their specialty.
Those real-world insights are so valuable. It's one thing to read about a specialty, but it's another thing entirely to hear from someone who's living it day in and day out. Their perspectives can really illuminate the path for you.
Absolutely. Reach out to people you admire, physicians who inspire you. Most doctors are happy to chat with students and share their experiences. It's all about building your network and learning from those who've gone before you.
Okay, so we've covered a ton of great advice. We talked about different types of resources, how to use them effectively, and the importance of self-reflection, mentorship, and work-life balance. Any final thoughts before we wrap up this part of the deep dive?
Choosing a specialty is a big decision, but it doesn't have to be overwhelming. Approach it with curiosity, a willingness to explore and trust in your own intuition. You have all the tools you need to make a decision that feels right for you.
That's such a great reminder. It's about trusting the process, being open to new discoveries, and believing in yourself.
Exactly. And no matter what specialty you choose, you're entering a profession that is filled with purpose, meaning, and the opportunity to make a real difference in the world.
I'm feeling so inspired right now. We've only scratched the surface of this topic.
There's so much more to explore. Join us for part 3 of this deep dive, where we'll delve into some of the more nuanced aspects of choosing a specialty.
See you soon. Welcome back to the deep dive. We're in the final stretch of our exploration into choosing a medical specialty.
We've covered a lot of ground, from personal interests and lifestyle considerations to practical steps and a wealth of resources.
It's been quite a journey. But even after all that, I imagine there are still moments of doubt. Those times when you encounter conflicting information or just feel a bit lost in the sea of possibilities.
Well, absolutely. Those feelings are totally normal. It's a big decision, and there's no magic formula to find that perfect specialty.
Exactly. So how do we deal with those moments of uncertainty? How do we make a choice when there's no clear right answer?
One approach is to shift your perspective a bit. Instead of searching for the perfect specialty, try aiming for a good enough fit.
Good enough. What do you mean by that?
It's about recognizing that no specialty is perfect. Every field has its pros and cons, its challenges and rewards. And sometimes what might seem like a deal breaker on paper turns out to be a minor inconvenience in reality.
That makes a lot of sense. It takes the pressure off, right? It's not about finding a specialty that checks every single box. It's about finding one that aligns with your core values and priorities.
Exactly. And keep in mind your interests and priorities might change over time. What feels like a perfect fit right now could shift as you gain more experience.
I'm thinking back to your story about starting out with an interest in surgery and ultimately finding your passion in family medicine.
Yeah, it wasn't a straight line, that's for sure. There were definitely moments of doubt along the way. But ultimately, I trusted my gut feeling and chose the path that felt most aligned with who I am and how I wanted my life to look.
It's a good reminder that we don't have to have it all figured out right now. There's room for growth and change along the way.
Absolutely. The world's medicine is constantly evolving, and so are you.
Okay, so we've talked about shifting our perspective and embracing the possibility of change. Any other tips for dealing with those pesky doubts?
Here's a technique I found helpful. Create a pros and cons list for each specialty you're considering. But go beyond the generic. Instead, make those pros and cons as specific and personal as possible.
So instead of simply writing long hours as a con for surgery, I might write, I wouldn't be able to make it to my kids' soccer games, or I wouldn't have time to train for that marathon I've always dreamed of running.
Exactly. The more you connect those abstract ideas to the realities of your life, the more those lists will truly reflect your values. Don't be afraid to get creative too. Include things like opportunities to do research, potential for leadership roles, or even likelihood of encountering adorable animals on a daily basis if that's something that matters to you.
I love that. It reminds us to have a little fun with this process. It doesn't have to be all serious business.
Absolutely. Choosing a specialty is a huge decision, but it's also an exciting journey. Enjoy the exploration, trust your instincts, and remember, there's no single right answer. The best choice is the one that feels right for you.
I'm feeling a lot more optimistic and empowered now. It seems like we've covered pretty much everything when it comes to choosing a specialty.
We've certainly given it our best shot, but remember, you're not alone on this path. You have mentors, peers, and a whole community of resources to support you every step of the way.
So true. I'm feeling incredibly grateful for all the wisdom and support that's available to us.
Speaking of support, don't hesitate to revisit those resources you gathered. Those professional organizations, specialty societies, online forums, they're full of valuable insights and advice.
They're like a lifeline guiding us through the sometimes choppy waters of medical training.
Exactly. And don't forget to reach out to those role models and mentors you identified. They've walked this path before, and their experiences can be incredibly valuable as you make your own choices.
Their stories remind us that it's possible to find a path that aligns with both our professional goals and our personal values.
Absolutely. And at the end of the day, remember this. No matter what specialty you choose, you're embarking on a journey that's filled with purpose and meaning. You have the power to make a real difference in the world.
That's what it's all about.
Yeah.
It's about finding a path that allows you to use your skills and passions to make a positive impact on others.
Exactly. And remember, the world of medicine is vast and ever evolving. There's always room for growth, exploration, and even the possibility of changing course along the way.
Thanks for joining us on this deep dive. We hope you gained some clarity, a renewed sense of excitement, and a toolbox full of resources to guide you on your journey.
Keep exploring, keep asking questions, and trust your instincts. We have no doubt that you'll make an incredible doctor no matter what path you choose.
Until next time, keep those brains buzzing. and those hearts passionate.